Summer Grandy.
I'm Zenya Ledermann.
And we are really honored today to be able to talk to you all about utilizing data and community voices to create anti-hunger pathways in rural food bank agencies. Okay. So just to give you a rundown of what we'll be talking about today, first off, at the front, we're going to be talking about why this work matters, especially in anti-hunger work, especially right now with where we are. We'll be kind of giving you an overview of what our process looks like, give you some key takeaways that might be relevant to your organization, and then how you can apply this work going forward. So just a little bit more background. Again, my name is Summer Grandy. I'm the Director of Community Impact with Flagstaff Family Food Center. Now, what the heck does community impact mean? Well, for us, that means I lead our policy initiatives, I run our community engagement, and I manage our resource navigation for the organization.
And my name is Zenya Ledermann. I am the Programs Coordinator at the Flagstaff Family Food Center. And in short, that means I do a lot of different things, but that also means that I help manage our food drives, work in development and fundraising, as well as coordinate our Hunger Action Partnership Coalition. So who are we? As we mentioned, we are from the Flagstaff Family Food Center, Flagstaff, Arizona, that's in the northern region of the state, and we are a food bank and kitchen. So we operate a lot of different programs, some of the main ones being grocery assistance, and so that is through our food box distribution program. We have a warehouse location, which is our main office, and we do distributions through Tuesdays through Saturdays, and we also do neighborhood distributions, also referred to as mobile distributions, in about 10 different locations around our region, where we will bring all the food out there and set up kind of a pop-up style drive-through distribution. We also offer meal assistance through our kitchen location, and so that looks like daily lunches and hot dinners that are a takeout and or dine-in option. And we also are the sole provider of food to our emergency shelter in town. We also have a self-serve pantry through the Grand Canyon Food Pantry, which is a walk-through like client choice model located in actually the Grand Canyon Village. And we have an agency shopping program. So that means that registered nonprofits or other organizations can come to our warehouse and shop for their clients or their base.
Okay, so outside of our primary programs, we also have some secondary programs as well. The first being, like I mentioned earlier, we do resource navigation, so that's one-on-one, assisting clients with SNAP, Medicaid applications, as well as helping navigate through other resources like housing, transportation, financial, and other local resources. At our kitchen, we recently installed a community garden where we use some of that produce to be able to use in our kitchen to produce those meals, as well as it's open for anybody for personal use. Lastly, the food we can't use that's inedible for human consumption, we also partner with local farmers so that they can use it for their animal feed as well as composting efforts. So, let's talk about size, just to give you a little bit of idea. Through all of those programs, we were able to give out 6.1 million meals to the community last year, which equated to around $22.8 million injected into the local economy. Through that kitchen alone, our kitchen team, I like to call them magicians, they prepared 483,000 meals for the community last year, and through that agency shopping program, we were able to distribute 239,000 pounds of food to other local nonprofits. And lastly, through that farm food program, we were able to divert 276,000 pounds from the landfill. So through all of those, just to give you a little glimpse into the size, we were able to serve around 41,000 people in our region. So enough about us. We're gonna go into why this work matters. So frankly, for us, the first reason is that the growth of food insecurity is unsustainable. How many, just by a raise of hands, how many of you have seen the rate of food insecurity in your region increase post-pandemic? Right, yeah, so that's what we expected. Go to the next slide. So, and we're gonna walk around, we're kind of walkers, so I hope that's okay with you all. So this is the USDA data on food insecurity, and you can see 2021 plus, we saw a very sharp increase, both in general food insecurity rates and very low food insecurity. Now what that means for our region is, if you can look on the right, Coconino, Navajo, and Apache all experienced this as well, on top of the fact that they already experience higher rates of food insecurity for both adults and children than the Arizona state average and the national average. So we saw these national rates mimicked both in our food distribution programs and at our kitchen program, where we serve largely folks who are facing very low food security, or as Zenya will explain later, we describe that as hunger. So we are extremely blessed with leadership that really saw these increased needs, and we responded to, if nothing changed, could we continue to match the community need if the increase stayed at the current rate? And based off of that, we decided that in addition to our responsibility to continue to remain a safety net for the community and the region, we also had a responsibility to be a source of resiliency for the community and start looking at the root causes of hunger and food insecurity in our community. Now, the first step for us in that meant that we needed to ask or engage our community in conversation, start asking questions. Now, this always brings up the question, does asking more questions increase barriers? Now, unfortunately, I don't have a solid yes or no answer for you today, but I think the most important answer is that we started grappling with this question and started to see how we could engage our community in conversation to build resiliency.
Second, this work is important because no one else is quite doing this. Now, of course, we know so many other people are doing so much good work, but specifically for our region, this work is really unique because there hasn't really been a needs assessment kind of like we did. So we made one. So going again, the reasons why we did is we felt there really needs to be a rural focus. Like I said, we are from Flagstaff, Arizona. Can I get a quick shout out? What's the first thing you think of when you think of Arizona? Desert, cactus, Grand Canyon, yes. Well, like I said, we're in Flagstaff, and we are actually a mountain town. This is our mountain here, Mount Humphreys, and we are one of the snowiest places in the country. So we experience things much differently than the southern half of our state, and different than Phoenix, which is the main metropolitan area. And so that being said, oftentimes the rural focus and the rural voice has been left out of conversations in our state. And I'm sure I'm seeing some head nods, so I know you guys can relate to that. So that being said, the work that we were doing was unique to what we have seen in our region. Additionally, this was work completed by food bankers about food banks and their clients. So we also wanted to share the experiences of our food insecure neighbors and those unique challenges that they face. So we also wanted, one of the reasons why we are here today is to show other organizations how you guys can complete and conduct your own research in whatever level makes sense to you, and then provide action steps to how you can actually implement those findings from that research into your programming. So one of the questions I just want you to ponder through this presentation is, what conversations have you and your organizations been left out of?
Before we move forward too, we kind of just jumped ahead because we're so excited to be able to talk to you today. There should be flyers all around that on the back have these questions with them so that y'all can engage with these questions with your own organizations to help move this work forward.
There's a few different flyers out there too, so yeah. You can always grab them at the end or throughout as well. So another reason why this work matters and why we're here today is because we need food bank-centric reports. So we made one. As you guys know, a lot of research is quite academic. It's not always connected to the base, or it's really like discussion focused, and so we wanted to do something that was very much connected to our client needs, and that way it could resist any assumptions about the people that we serve, especially things that may not fit our region or fit the experiences that people are facing. And so, me and Summer conducted a lot of this research ourselves. It was not outsourced to an organization, which is also why this is unique and why we wanted to stay connected to our base. This also allowed us to build trust and understanding with the people that we were serving, to really show them, we're here, we want to listen to you, and we really want to know what you're experiencing so we can better understand those needs. This also allowed us to link our advocacy efforts to those lived experiences, so really elevate those voices and those stories in all the advocacy that we do. It also acknowledges the local context, because as I mentioned, we are different than maybe other representative parts of our state, and there's unique challenges everywhere, of course. And so we really wanted to acknowledge that local context and what it looks like for our clients, and then actually use those results in our programming. So another question I'm going to leave you to ponder is, in what ways has the food bank voice been left out of food systems conversations in your region or in your work?
Lastly, one of the most important reasons for us is the realization that urban and rural food insecurity are just a tad different from each other. So just to give you a more local context of what this looks like for us, this is population per square mile. I bet y'all can guess where this region is. That's the Phoenix metropolitan area, and where we're operating is that circle. So we largely operate in Coconino County, Navajo County, and Apache County. Now, Coconino County is the second largest county in the US by land mass and has 144,000 people. Now, about half of those people are in that little red urban center called Flagstaff, where we're at. And so you can see that based off of how rural this region is, they interact with food a lot differently than their urban counterparts. First off, many households in this region lack electricity, water, or natural gas. Second, we have higher unemployment rates than our metropolitan counterparts. And lastly, this is one of the largest food apartheids in the country. So, some more questions for you. One, whether you're rural or not, you have unique challenges to your specific area, so we want you to think through what challenges are unique to your area. And then second, whether you're rural or not, again, how do you consider rural areas in your strategic planning? Now, I'd like to just get a show of hands again. Can you raise your hand if you're coming from a rural area today? Yeah, we love to see you guys. We love to see the urban counterparts too, but that's very exciting. Cool. Okay.
So at the end of the day, we're really hoping that this report and presentation can serve as an example for what smaller food pantries or organizations can do for the larger anti-hunger and food systems movement.
Like our CEO likes to say, we're a regular food bank, guys. We're not like the other food banks. So let's go over our process a little bit. So this is a lot to look at. So let's go back to when I said that we realized we had a responsibility to look into resiliency and root causes of hunger and food insecurity. Well, we did this through creating what we called the Client Advocacy Department. When we initially created that department, we had this roadmap of what we wanted that to look like, right? We have some categories that we knew we should probably work within, but most importantly, we had pillars. One, we wanted it to be client-centric. We wanted the clients and the community to really drive this work moving forward. Two, we wanted it to be trauma-informed. We wanted the experiences of those facing food insecurity and hunger to be at the forefront and to be integrated into this work. And then for the last two, we didn't want to reinvent the wheel again and again. We realized that we needed to be innovative and collaborative in order to create something truly impactful. So the first step that we realized in all of this was creating conversation with the community. So you're probably gonna get an arm workout by the end of this, but another question for you that we had is, how often do you have direct conversations with the people you serve? So raise your hand if you've had direct conversation with your community in the last 3 years. Okay, how about in the last year? Last 6 months? Nice! Awesome. Woo! That's very, very exciting. So, this is the timeline that it took us to be able to do this work the first year, and really what I want you to see in this is how long it took us. And we wanted to show this because we realized that it's a big endeavor to do the first year, but we we knew that it had to be diligent, it had to be thoughtful, and we had to move, and this is becoming a very used quote, but at the speed of trust this first year, so that it was authentic, it was meaningful, and that we were really being intentional. So we created the department in September 2023, and really it took us all of last year to be able to do that, and we published it this January, which is really exciting. I did put some copies on the back. I don't see them anymore, so thank you guys for taking them. If you find one of us throughout that, we brought way too many to DC, so we'd be happy to share with you.
So I'm going to talk a little bit more about our clients. Who are they? So, as you can see here is another map of Arizona. That is roughly the region that we operate in, and so that's Coconino, Navajo, and Apache counties, and Flagstaff is kind of in the middle of that. If you look at the map on the right, that is something we have created through our internal program data that is the top 20 cities of residence that our clients are coming to us from. So those little orange apples, if you can see them, are the cities in which people are coming to. And the blue carrots are the different locations where we have our operations. So either through our offices, our neighborhood distributions, or Grand Canyon Pantry. So as you can see, people really are traveling to access our services. Now, a lot of them may be coming to Flagstaff because it is kind of the major hub in our area for other reasons, but while they're there, they're accessing our services. So this was something really impactful for us to know, to be where are people coming from? Who is utilizing our services? And this is also important to note because Kayenta, which is this all the way up here, that's 2.5 hours from us in a drive. Over here, Sanders, that's about 2 hours, and even Ash Fork, which seems close to Flagstaff, is about an hour away. So this is all to say that people are traveling a long distance, and in this region, these grayed out areas here, those are Native American reservations. So we are quite close to the Navajo Nation. It also encompasses the Hopi Reservation, and there's lots of others within this area. But that's impactful to us because over 50% of our clients identify as Native American. So that's something helpful for us to know of how we can better serve and really target our programming to better serve their needs. So about our research process in general, so what the heck is it that we did? So we, as Summer mentioned, we collected lots of qualitative and quantitative data, and that was in the form of surveys, interviews, and focus groups. So for surveys, we had both in-person and virtual options for clients to complete. And in total, we got 232 responses from distribution clients. So again, that's those food box distributions. And then 89 from kitchen clients, so the prepared meals. Then for interviews, we conducted 30 one-on-one in-person interviews with our kitchen clients. And each of these ranged between 10 to 25 minutes each and took place at our kitchen. That's how we sourced them as well. Then we did 7 different focus groups. Those were also a mix of in-person and virtual options. In total, it was 33 participants, and each of those focus groups were roughly an hour long. And so through doing all this research, then we would transcribe what we had, analyze it, take lots of notes to then create the results that we found, which we will talk about a little bit later. And in that, we also offered incentives. Incentives and compensation are very important because we acknowledge the time and effort that people are sharing and the vulnerability of sharing their experiences around food. And so for those conversations, the interviews and focus groups, we offered a $50 gift card for anyone who participated in those. And then for the survey, anyone who completed a survey was entered to win a $250 gift card.
And I would just say you should be ready to offer compensation or incentives. It's quite industry standard nowadays because as you would pay a consultant in IT or graphic designing for their time and expertise, so you would too for someone with lived experience with food insecurity. Again, like Zenya said, because of their time, their expertise, and their vulnerability. So this is how the components of the report ended up looking like. So of course we had quantitative data, that's that internal program data. So if you give out government commodities, you automatically likely have internal data, but if you don't, you will probably have some sort of data, how many meals you handed out, maybe some basic demographics that you can easily pull from and should be looking at to map out who it is you're serving and interacting with. Next, we did use public data. Obviously, we have big sources like Feeding America, USDA, the Census of Ag, just the census in general, but also you should be looking into your public sources, like your county health assessments. A lot of cities or counties are also doing food system assessments, and that's a really good resource. We're really looking at those local resources because they know your community better than obviously the federal data sources do. We also did one piece of direct analysis, which is our grocery cost analysis, where we looked at grocery price comparisons across the region. You might look at other types of direct analysis depending on the experiences of those you interact with, but this was really vital to us, especially given that food apartheid that I discussed earlier. And then lastly, like Zenya mentioned, the qualitative data that focused on the focus group surveys and interviews.
All right, so now let's talk a little bit about our key takeaways. What were our findings from all of this research? I'm going to start by talking about food insecurity. I am sure you all know what food insecurity is, but for the sake of this report and presentation, we used the Feeding America definition, which is the lack of access to enough food for a healthy lifestyle. So one of the ways that this looks is this is our survey responses, and so we asked what percentage of your family's food intake do you receive from any of our services. And so as you can see, a lot of it does come, and when you encompass the more than half or about half, a lot of people are receiving their food from us as their primary food intake. And out of those, only 21% are not able to cover the rest of it, and only 45% are sometimes able to cover the rest of their family's food intake. And so this was really important for us to kind of get a baseline of what does food insecurity look like in our community, and how does that actually play out? And more so, how are people relying on us? What does that actually look like? And why are they using our services? And so even with that, you can see these quotes that we got from participants that sometimes people get stuck on how to use all the food. And so whether that's because they get too much bulk items at once and they don't know how to use it all, or it's spoiled, or it doesn't fit their cultural or health needs, or simply it's a unique item that they're unfamiliar with or don't have the resources to use. And with that too, as we all agree, people did say that the accessibility of food and its resources needs to be prioritized.
Now, before we move on from this, I think it's Zenya just mentioned a good way to operationalize and use that data internally. You can also use this data externally. So we were hearing Representative Craig talk earlier about the need for SNAP and the need for diverse food access. This is a good way to leverage that with your decision makers, because we're out here saying, hey guys, we're drowning. This food insecurity rate is getting quite crazy, and a lot of people are relying on this service. You need to help us out through public assistance programs like SNAP or Double Up Food Bucks, or so on and so forth. But this is a good tool to leverage with your decision makers.
Now, we also conducted lots of community conversations. So this is a mind map. Can I get a raise of hands who has ever seen or made or worked with a mind map before?
Yay!
Okay, cool. You never know. So it seems familiar to some folks, so that's great, but I am still kind of going to break it down and walk through what this is and how we visualized our data. So, as I've mentioned, the community conversations are qualitative data. Those were those stories and experiences that we gathered through folks. And qualitative data is messy. It doesn't always fit into percentages or graphs or categories like some of the quantitative does. So this way, we really wanted to showcase what are things looking like. And of course, as we know, all of these aspects are connected. Food insecurity does not stand on its own, and that's something that really is visualized here. So I'm going to point your attention to those starred ones. Those are the main takeaways I'm going to be talking about today, and I'm also going to break it down a little bit. And so this mind map in particular is those key priorities, the main themes that came out of our food distribution, so that those food box distributions. And another way that you can think about a mind map is think of it as a person at the center, and these are all of their experiences and the related and interconnected parts of their life and the ways that things are affecting them. So the first category, we broke it down into categories, and the first one I'm going to talk about is future focus. So in those conversations, we actually asked folks, what would you like us to prioritize in our 5-year strategic plan? And so these are some of the takeaways that came out of those conversations. The first one I'm going to talk about is rural challenges. As we've mentioned, we're rural, and there's lots of unique challenges associated with that, especially in our state. And so because of that, that's something that really should be prioritized because it then affects how people interact, access, and use food. The second one I'm going to talk about is a client choice model. So while we do have the Grand Canyon Food Pantry, there is not a client choice model, like a walk-through shopping model in Flagstaff. So that was seen as super important to the community, as showcased through this quote, that it would better help serve and meet their needs. That way they can really choose the things, especially if they have various restrictions, whether that be for utilization or their dietary restrictions, and they can avoid waste. The next section is neighbor needs. So we broke this down into themes and resources that clients identified as essential in order to address their needs or other things that were needed within the community that were currently missing. And so the one I'm really going to talk about here is utilization. As Summer mentioned, some of the folks that we serve do not have access to potable water. They have to haul their water. Some of them don't have electricity. There's no public transportation, or the roads are extremely hard to get to if they even have a vehicle. There's no in-home refrigeration. All of those things that then, even if you're able to access food, you aren't really able to use it. And again, that's showcased in this quote, that if you have medication that needs to be refrigerated, you're toast. And the last section I'm going to talk about here is collaboration opportunities. So these were themes highlighted by participants on areas or community resources, connections that really should be highlighted and focused on. And so the main ones here today are knowledge sharing and resource sharing. I think we can all agree and know how important those things are, especially because historically, all of these community services have been pretty siloed. They kind of operate in their own region, and especially since COVID, people have just been trying to keep up. But it is crucial because, again, these things they don't stand on their own. And so we have to be able to share and really work together. Otherwise, there's no way that we're ever going to create more food security. The next section here is hunger. And so again, for this report and for our work, we define food insecurity and hunger differently. And hunger is not knowing where one's next meal is going to come from. So can I get a quick show of hands? How many in your organizations or your personal lives differentiate hunger and food insecurity by definition? Okay, a few. And you may not need to, but for us, we found that is what works for our organization.
Okay, so let's go back into some of the survey results. One of the questions that we asked our community was, do you ever skip meals because you cannot afford or access them? Again, this is a question that looks into the severity of hunger in our community. And as you can see, over 75% of our community that access our services said yes or sometimes that they skip meals because they can't access or afford them. That's a huge response, both internally for us, because it tells us that folks are still slipping through the cracks, even with our current programs and our current community programs as well. But then it also is a great tool that we have to be able to talk to decision makers and other community partners about the experience of those facing hunger. Now, some of the reasons are kind of quoted up there, whether folks are on Social Security and it's not enough, whether their bills are going, or their income's going all to bills, or whether they're living on one income for a family of 5. This really kind of showcases the experience and gives us a glimpse into what that might be. So next up, something that was really important for us to look at in terms of hunger in our community was living situation. Now, where we are situated in Flagstaff, we are currently in a housing crisis since 2020 when the city declared it. Our median home price is $750,000, and we were one of the most expensive places to rent or buy during the pandemic. So we obviously needed to look at how that experience interrelated with hunger in our community. So at the bottom, you can kind of see those results highlighted, where over 60% of the people interacting with our services are in temporary housing. And as you all can probably guess, that significantly impacts your relationship to food. Because if you're living in a shelter, if you're living in a vehicle or somewhere outside, if we give you a food box that has raw meat or raw produce, that's probably not that useful to you. And also, your experience with food insecurity, with hunger, with your ability to get yourself out of that situation is probably different than others not living in that situation.
All right, and back to the community conversations and our mind maps. So these ones are specifically around hunger. So this is the key priorities for our kitchen location, what came out of those conversations. And I'm not going to get super into the nitty-gritty for this. There are a lot of overlaps between our findings for our distribution clients and our kitchen clients, though as some are shared, things are different and we can understand why those reasons are. I will share that if you are interested in getting in the nitty-gritty about these results, in the appendix of our food equity report, which we have copies, but we will also provide a virtual option, we do a whole breakdown of these findings and next steps and really what they mean. So if you're curious about those, take a look there or ask us any questions once we open it up for questions. So part of what we wanted to share here, though, is that you can make a mind map in many different ways. We also made one for food security. So we asked clients in those conversations, what does food security look like to you? And so this is a culmination of their responses, their challenges, or all of the additional ways or facets that they are impacted by food security and or insecurity. And so this is really important for us to know, so instead of just assuming or using kind of those generic definitions, to learn what does being food insecure look like to our clients and our community. We also made a mind map of neighbor needs, so really focusing in on what were those physical needs, those tangible items, the services, or the other larger systemic changes that are needed in order to have people really meet their needs or feel comfortable in their lives. And so this is all to say that you can visualize data or make data in any way that works for you. We've made multiple others too that we've used for just our internal programs, but this is one way that you can really make sense of that qualitative data. And so a question I'm going to leave you guys with is, what mind map would you make for your community, or how would you like to visualize your qualitative data?
Okay, next up is that grocery price comparison, which is the direct analysis that we did. And this is kind of the scope of what that ended up looking like. So for us, we compared all of these locations to Flagstaff because obviously we are in Flagstaff, but some of the more important reasons is that Flagstaff is the metropolitan kind of center for Northern Arizona, so a lot of people come into Flagstaff for medical appointments or to stock up on groceries. And so we compared all of these locations to the prices in Flagstaff. Now, a couple different highlights that I just want to share with you is that one of the assumptions that we had is that grocery prices were going to be, by and large, just more expensive across northeastern Arizona, and what we found was quite different. So, as you can see in Pinion, protein, produce, and eggs were largely cheaper across northeastern Arizona than in Flagstaff, which was a surprising finding for us. Considering Flagstaff is located right against two major highways, we had expected logistically that the opposite would be true. And then on the opposite side, shelf-stable items across northeastern Arizona were more expensive, and that's especially true, as you can see here, for formula, where in Winslow is 460% higher than it is in Flagstaff, if it's available at all, because we couldn't find it in Pinion or Ganado. Now, this gives us a really important insight into the experiences of those in our community, because let's just say you are a mom and maybe you're in Ganado. Well, you don't have formula, and so you're going to need to go to Winslow to get that formula, but that formula is 460% higher, and so then you have less purchasing power for other things. And that's just basic formula, right? That doesn't go into hypoallergenic or specific ingredient and formula. And so this just kind of helps us map out that experience more and lead based off of data and not assumptions. So all of that led us to these following key insights. One being that Northern Arizona faces unique challenges. We've told you about some of those today, like transportation, housing, and that contributes, those all contribute to higher rates of food insecurity and a different relationship to food than our urban counterparts.
Second, food insecurity is intersectional. I think we all understand this, and clients face multiple adversities and challenges in accessing and using food. And that's really highlighted here by one of our quotes. If someone has difficulty just moving around, how are you going to do any of the other things that you need to do?
Next up, you've heard us say food utilization. This was a really key priority, especially as we look internally. So, especially for those experiencing homelessness or those rural populations lacking utilities, the way people are able to utilize the food that we give them or utilize food in general is going to be a key priority moving forward.
Next, the community really needs an increase in choice and variety of food, such as a client choice model or other methods that are able to have them focus on what works for them.
The next up is the community needs us to collaborate. This is a really big thing they kept on saying, is that you guys probably know the tale that you have to tell your story 10 times before you access a resource. And this was really significant in those conversations because it really did map out how hard it is to just find basic assistance.
There also needs to be continued investments in programs that help at diverse food access. So things like SNAP, Double Up, WIC, Farmers Market Nutrition Program, because having just one food access point is not enough.
And lastly, health disparities is a huge one, and I'm sure you all are having this conversation internally with your own communities, but especially in northeastern Arizona, we realize that this needs to be both, there needs to be more investment in researching what that looks like, but also needs to be a priority for us internally and for externally, decision makers, other nonprofits. Everyone in the community really does need to be thinking about health disparities and how they contribute to it or their relationship to it. So now let's go into how to apply this work. I just want to say before we go on that many of you are experts in food insecurity, so we're not trying to teach you that food insecurity is intersectional. But I think what this has taught us is that not everyone has that expert level of knowledge, and that it's maybe our role as the experts to use this data and to showcase this information to move the anti-hunger work forward. So, how did we do this? I showed you this roadmap in the beginning. And in 2024, we were able to create conversations with the community, and that changed this roadmap. So if you go to the next slide, you can see that it zoomed in on certain areas that we wanted to work in. It renamed some of them. Instead of just education, folks really talked about wanting empowerment, wanting resiliency, wanting to be autonomous. And so we reshaped how we were going to move forward with some of this work. So this report, one, enabled us to revise our internal operations to better match the community needs. Now, who in this room does not want to do that? We all want to be able to meet our community needs at the best that we can.
One of the ways that we did this was trying to get at that diverse food access. So, client choice model, we've said that multiple times, clients were really wanting that. And so while we do have the Grand Canyon Food Pantry, which is a client choice model, there is not one in Flagstaff at the moment. And so we are actually in the process of opening a client choice model in Flagstaff, hopefully by the end of this year. We also wanted to increase accessibility of our resources and our programs, and so we've done that actually through our food distributions that historically had operated as a drive-through, like in vehicles in a drive-through food box, you load them up model. But what happens when people don't have vehicles or if they aren't able to get to those locations? So what we have done is offered a walk-up table, so folks who are on foot or don't have a vehicle are able to still access those same distributions. And from there too, we are hoping and in the process of even creating a separate kind of system for that, where clients can then choose at those distributions if they want to just get loaded up with a food box or do a shop when they visit. And so that's through doing a market model or just trying to increase that accessibility in all ways of our current programs.
Next up is education and empowerment. We were able to see that this is a key priority to our community. I think oftentimes we just assume that it is and just go forward with it, but we were able to see that this is a key priority to the community and see how we should be able to interact with that. So again, going back to those pillars, we did not want to reinvent the wheel. We wanted to be collaborative. So part of that is that we were able to partner with people like SNAP Ed in getting nutrition and gardening courses integrated into our programs, because we as food banks don't need to do everything. But then also we wanted to, instead of just offering food bank to client recipes, which may feel a little patronizing to people or out of touch, we wanted to create a recipe sharing network that the clients were asking for so that they can share recipes with each other. Next, in that long-term planning, we also look to other food banks often. So we wanted to integrate work training programs into our warehouse and our kitchen programs so that we could integrate education and empowerment. And then lastly, we were able to partner with DES so that we now offer SNAP and Medicaid assistance at our kitchen and distribution centers, and also do SNAP outreach. Second, which I think is really exciting for this conference and this room, is that this work truly allowed us to engage in anti-hunger work way more authentically and powerfully.
One of the ways that we have done this is through the creation of an anti-hunger coalition. So we have created the Northern Arizona Hunger Action Partnership, which is a coalition for anyone to participate in, but it encompasses a lot of community partners, some clients, or other people who are doing related work or are interested in hunger and food insecurity. And so we have recently established our mission, vision, and values that really came from a survey we sent out to everyone who was involved to come up with these, along with our 2025 priorities. So those are resource navigation, community empowerment, and advocacy, which have turned into our work groups for people to really connect in on and have a space to network, to get to know each other, to figure out how can we better streamline all of the work that we're doing.
Before we move on to, I just want to also add that this report, we were able to engage the coalition and showcase the data from this to build these priorities too. So we're taking that one step further, and the Hunger Action Partner itself is being client-centered instead of us all coming together and making assumptions.
And so here's a little bit of the work that we've done. We've had 4 quarterly gatherings since last year, and it encompasses about 90 different participants, and we've had a mix of presentations, networking opportunities, and activities to really get together and try to strategize of how we can better serve our community.
Now, who, by raise of hands, is a fellow food policy nerd in the room? Yay, some of you. So, advocacy is one of the ways, I mean, I'm biased because that's part of my work, but that I've truly been able to use this really, really powerfully. So that comes from both the top-down. Based off this report and all the momentum within our organization, our governor, Katie Hobbs, actually reached out to us to be able to tour our kitchen and to be able to talk to us about the experience of food insecurity and hunger in Northern Arizona. So our VP likes to say that we didn't just give ourselves a seat at the table, we made the dang seat. And I think that's what this report really enabled us to do. And then it also came from the bottom up. So we've been watching policies come through our state legislative session this year, which I don't know if you guys are working against the think tank FGA. I just can't even get into it. But they have been coming to Arizona as well as other states trying to pass bills that change SNAP, change Medicaid, its access in our state, or change other bills based off of they just want federal cuts. And we were able to be there to share the experience of those in northern Arizona to our legislators who by and large did not understand the experience of those in northern Arizona. One of our legislators had, in my opinion, the audacity to say that hunger can be a motivator for those to get out of their situation, which I think anybody in this room would agree that's not the case, nor would we ever say that to a child or a senior. So this has enabled us to be there to be like, well, actually, or to be able to build those relationships so that we can educate what the experience of northern Arizona is truly like. Lastly, I don't know if you all have been just kind of pondering what the food bank's responsibility is in the larger food systems conversation, but this gave us a little bit more information into what that might look like. One of the things that it's enabled us to do is really start advocating for LFPA, or the Local Food Purchase Assistance Cooperative Agreement Program, and if you were the person to name that, I have a bone to pick with you. But we are here right now actually trying to convince our very conservative representative to maybe co-sponsor something like this in the future, because we've realized this is not only really meaningful to our community and our clients, but it's also really super meaningful to our local farmers. So lastly, thinking long term, this report has really allowed us to devise a strategic plan, 3, 5, 10 year, that really matches the community's request and is based off of what the community has told us.
So with that, we are kind of concluding today, and we want to just showcase that this work can be done. We are just one example of the ways that you can do this, but it's not the only way. And so if you are interested in viewing the full report, that is that QR code or link on the right-hand side, and if you are interested in connecting with us, either to get any of our resources, our slides, or just communicate, try to strategize together, we have a little Google form that you can reach out to us in. And those are also on some of the flyers that we have out there, or you can always come up to us and ask as well.
Yeah, I think we ran out of flyers because we realized 2 things in this work. 1, anti-hunger work cannot be done without the people in this room, without those in rural communities working on the ground with the community to drive the changes. 2, we've realized that us rural agencies cannot do it alone. We have limited resources, limited time, and a lot of freaking work to do. So we are really here today so that we can all start to connect and that we can get involved in the anti-hunger work together. So with that, we will open it up for questions. I guess if you guys want to come to the mic, I don't really know how this works, so.
You can also pass it around, but I don't want to miss anyone, so.